hand.
Good morning, everyone. I'm Megan Cullop, along here with Scott Micklin.
That is my name. Good morning. There's a bit of a pause there,
Scott,
but okay.
Shoot.
Scott, somebody.
Scott.
What's his name? Got it. Good morning. It's Monday, May 11th, and we welcome you to our COVID-19 local information program here on KSJE. We're glad that you are with us, everybody. And again, we've got a great day of information to share and some great guests who'll be calling in. And so we appreciate that as well as we share information as we move forward in this thing we were just talking about. It's May 11th already.
Yeah, but it feels like it's been a decade.
Right?
Yeah.
Yeah, it kind of does, and I understand that. But, you know.
You've gotten a little grayer.
We're in this together. Well, that's working with you. What can I say?
That was good.
Yeah, but that's
good.
all right.
Yeah.
It's okay. I'm not going for my usual touch-ups. You know, that's the problem.
Yeah, there you go.
Maybe
You're
that's
being very good about the
That's
physically distancing and following the rules.
Yes,
So, speaking of May 11th and dates,
Okay.
I discovered this morning, I looked on my bedside table and I was like, oh my gosh, for the first time in my life, I actually bought a planner this year.
Oh.
But here we are.
Uh-huh. You
What
using that a lot or no? Not so much.
Yeah, exactly. It's like I just mark out each hour of the day that I get frustrated.
Get up.
Like, hour
Stay
one,
away from people.
Run on Clorox.
Don't touch my face.
Right, exactly. Blocking out 30-minute intervals of washing hands. Yeah.
Yeah.
I just find that very ironic. You know, at the beginning of the year, I was like, this is the year I'm going to use a planner and be a little more organized. And then
This happens.
hashtag pandemic.
We can blame you, I guess. Is that what you're saying?
Yeah, it's like people
You're
who
buying
have
the planner
umbrellas.
caused an entire global pandemic.
I think so.
Okay.
That's how that works.
Maybe. I don't know. But all right, very good. Let me call up some numbers
We'll call
here.
up some numbers.
And we can start the show with that. And then, of course, we can let folks know that later on we'll be joined by Jeff Bourgeois, the CEO of San Juan Regional Medical Center. He's going to be calling in today to give us an idea of what's going on at the hospital these
Mr.
days.
Jeff.
We appreciate his weekly call. Kind of get the week started off right. So stand by, everybody. On a different subject, it's nice to see the rain today.
Right, yeah,
You know,
one less
we always
night
need
that I have to
rain.
water my lawn.
Yeah, we always need rain, so that's always good. Okay, here we go. So the latest numbers from over the weekend, of course, we are at New Mexico is at 4,863 cases. That was an addition of 87 on Sunday. There was that, again, disclaimer about they're not getting all the data on Sundays from all the labs, so that number may be higher tomorrow when they add all those numbers in that weren't reported on Sunday. San Juan County, of course, we had 20 additional cases. We've now been, over the weekend, we hit 1,000, and so that happened. Another 9 additional deaths in our state, so that's a total of 200 now. 2 additional deaths in San Juan County from that number on Sunday, so a total of 69. Recoveries are at 1,285. So we have that as well. And again, this is from KSJE.com and our news segment, and we've got lots of local news stories that are compiled there, and we always tell you where the information is coming from. There's more details about the daily statistics for the state of New Mexico and San Juan County. The Navajo Nation, they're now at 3,122. They had 149 over the weekend and 4 additional deaths. So again, those numbers are still high coming in off of the reservation. Also point out that La Plata County saw its first fatality, COVID-19 related fatality, and they had 3 more cases, but their numbers are fairly low compared to elsewhere, but still the fact that they've had a fatality, I think, tells you that this is serious everywhere.
For sure. definitely serious everywhere.
Yeah.
Now, remind me again, the Navajo Nation numbers that we have, is that just for this like San Juan County piece, the New Mexico piece, or is that the entire?
The entire Navajo Nation.
Okay.
They are no longer reporting numbers from the border towns. So these are people on the reservation land, like in San Juan County, that have tested positive for COVID-19.
Right.
So they're no longer
But it's still
reporting.
accounting for Utah and Arizona,
Yes.
too.
Yes,
Okay.
indeed. Reservation-wide.
Interesting.
True. Exactly.
I wonder if we can get a more specific number.
Well, and sometimes they break them down, but
Yeah.
but this particular release they did not
Okay.
in the different counties.
Right.
And so we've seen it both ways, and so we kind of share what they send us, but we haven't seen it broken down. At least yesterday, they did not send those numbers out.
Gotcha.
So there
and
you
we're
go.
still doing weekend curfews, I believe, out
The
there.
Navajo Nation is doing that. That's right. And of course, City of Gallup was locked down by the governor and a mayoral request. So there was that happened as well. So we'll see if any of the McKinley County numbers go down a little bit. Yeah, because of that. Because that would be
That'd be good.
Yeah, it would be good.
That means it worked.
Exactly. So let's take a look. I'm trying to see one more story here from the Navajo Nation, an earlier report, to see if maybe they are showing what you're asking for. And let's see if I scroll down. Nope, I don't think so.
Okay.
Anyway, so I think I update that
the
story.
detention policies update is an interesting one.
Okay.
Well, because
Yeah.
I saw a report this morning in the Daily Times. Shout out Daily Times that
Right.
the juvenile detention center does not have any positive cases. So
Good.
that's good.
Right. Well, we've heard about breakouts in jails and in detention
Of course,
facilities
of
across the
course.
country, and that's a real concern. So
Yes.
that's a big issue for
Yeah.
anyone.
That's why you can't do in-person visits anymore.
That's right. So there's that. That's important. But
Right.
anyway,
Pretty
so-
close quarters over there.
Very much, indeed. So we want to keep everyone safe, if we can. So that's the idea. So very good. Jeff Bourgeois will be calling in shortly.
Okay.
And so we appreciate him calling in. And so there's that coming up. But other than that, you were making a donation, I
things?
think. I want to ask you a little bit about your
Sure.
travels
Sure. Yeah.
from your other job.
Correct.
Yeah.
My other hustle.
Yeah.
Yeah. Yes.
I don't think you can call it a side hustle.
No, I don't.
No.
I think this is the side hustle.
This is probably the side
okay.
hustle.
Cool.
That's your front hustle. I don't even know if that's a term.
I don't think that's a term.
No.
But I like it.
Okay.
The lead hustle.
Yeah.
Okay.
Let's get that trending, everybody. Hashtag front hustle.
People are not going to know what to do with that.
No.
Okay, so the First Presbyterian Church Missions Committee sauced a few $100s, $300 to purchase snacks and drinks for the nursing staff at Northern Navajo Nation Hospital. So
In Shiprock. Nice.
Right.
Yeah.
So we got these giant laundry baskets, and they're overflowing with various junk food items, which I feel like, I consume junk food with impunity, but I also
That's
feel
why
like,
we're friends.
Right, that's why we're friends.
Yeah.
But I definitely feel like ICU nurses get a pass on all of that. And then we have
no
like
kidding.
Gatorade and stuff like that. And so,
They've got to be burning so many calories anyway. So
I think so. They're
they-
on their feet all the time.
Yeah, so why not, right?
Why not have a zebra cake?
Yeah. Oh,
Yeah.
Nice.
Oh, yeah. Oh, I was like, I was doing some shopping, 6 feet apart with a mask with another member, and, we weren't being stingy. We were like, initially we're like, do we do cookies or cake items? And then I'm like, wait, why are we being stingy? Let's just take this entire shelf. So
Nice.
we did.
Good for you.
Yeah. Bought a bunch in bulk, but it is important to point out the safety thing. So I pulled up to the main entrance.
delivery,
Yeah,
right,
I
the
had a mask
handoff.
off. They had mask on. They had masks, and just popped the trunk, and they pulled them out of the trunk, closed the door, off.
Off you went.
Off I went. So
With
it was
a
very
wave.
safe with a wave.
A smile and a wave.
and
Yeah. Peace out.
Peace out, guys.
There you go. Okay. Front hustle. There
yeah,
you go.
exactly.
Nice.
So yeah. So they were very appreciative, I think.
I'm sure they were. Yeah, definitely. And we're going to talk about other ways that we can help
Yes,
our
we
neighbors
are.
on the Navajo Nation a little
Yes,
bit
we
later on
are.
this hour. So stay tuned for that, everybody. Let's go to the phones.
Go to the phones.
We actually have 2 calls. So let's see if I pick the right one.
Well, I mean, it
Doesn't matter. They're both important.
They're both really important.
Because they both
so-
called. So let's see who's on the phone this morning. Good morning. You're on KSJE.
Good morning, Scott. This is Jeff Bourgeois.
Jeff Bourgeois, CEO of San Juan Regional Medical Center. Thank you for calling in, and we appreciate your time as always, of course. So can you give us kind of an update of how things are looking at the hospital on this Monday morning?
You bet. Well, Scott, first let me say that, last week was National Nurses Week, and we were proud to recognize our wonderful nursing staff. And then this week is National Hospital Week. So while we can't celebrate in the ways we would have in the past, we are finding unique ways to celebrate. And we have 20 individuals here who are celebrating 30-plus years of service to San Juan Regional, including Christine Charlie from our clinical lab, who has 50-plus years of service now, and Mary Babcock from our blood bank at 45 years of service. So we'll be doing some things to celebrate them and all the others who have made this such a great organization for our community.
Very good.
Our census this morning is 124, and that's up quite a bit from where we went into yesterday morning. But most of that increase was not related to COVID-related type patients. It was in other areas. So right now we have 33 positive COVID patients, 2 patients who are still pending test results. And we have now discharged over 100 patients home or to an alternative site of care after being treated here for COVID-19. So we've passed the century mark of getting people successfully out of the hospital, and we're very proud of that.
Congratulations. I think that's worth noting. And but again, do you know about how long those folks were in the hospital before they were able to be released? I know every case is different.
Yeah, it varies widely. God, I will tell you that if you have an ICU stay related to COVID-19, your length of stay is going to be around 12 days in the ICU, and then several days in our step-down unit post ICU care. For others who have a milder course of illness, it's typically a 5 to 10 day length of stay.
Got it. And that's something unique with COVID-19, is it not, Jeff Bourgeois, that most maybe ICU stays are not that long these days?
That's exactly right. And it is a longer length of stay than the average inpatient illness, no doubt about it.
And do each of those patients in the ICU, is it a given that they will be ventilated, or is that why they go up there to the ICU?
Hi, Megan. No, it's not a given. Oftentimes they just need really high flow oxygen support or other pharmaceutical and respiratory support, but not necessarily need to be ventilated. So while we have I think this morning I saw we had 11 patients in our COVID ICU, and 6 of those were intubated. So maybe that, that's not necessarily representative of every day, but that was our circumstance this morning.
Do we have a number of total fatalities of COVID-19 since this began, at San Juan Regional specifically?
Yes, there have been 39 of the 175 patients that we've treated that have expired.
Got it. Okay. And Jeff Bourgeois, I saw a report when we did a program last week with BPL Plasma about looking for donors, survivors of COVID-19, recovered COVID-19 patients, to donate blood plasma. I saw another, post and information from the hospital asking folks to consider doing that as well. Can you explain again a little bit why that's so important, to get maybe some local donations of these survivors and these folks that you have been able to discharge that have recovered from COVID-19, why that's such an important thing?
I'll be happy to, Scott. It's this is the particular course of illness and treatments available for this virus is still one that the entire medical community worldwide is learning about literally every day. And the what is referred to as convalescent plasma donors are felt to offer some a clinical pickup through the infusion of that convalescent plasma into an active COVID patient to help boost their immune system and their body's ability to respond to and fight the virus.
Do you guys still have the Monday? We haven't talked about it in a while, but the Monday and Wednesday testing tent facility?
They do. Yes.
Okay, cool. I'm just making sure that's still going on.
That is
Yeah.
external assessments, right, Mr.
Right.
Bourgeois?
That's right. Great question, and we are doing it Monday, Wednesday, and Friday, but we've made a slight change in the time of that. Instead of from 10 to 2, we're now doing 9 a.m. to 1 p.m. as the days have gotten warmer. For the staff people who are out there in the personal protective equipment, it can get really warm. So we started a little hour earlier so we can get them out of the heat sooner.
Very good. And again, Mr. Bourgeois, these are for folks who are suffering from specific symptoms and want to come and maybe be tested for COVID-19. That's kind of the requirements, right? Not just for everybody, but for people suffering from specific symptoms that are related to coronavirus?
Right, or certain exposure-related risks. So we encourage everyone to call Monday through Friday at 675-4722, and we have a nurse answering that phone, or nurses answering that phone line, if you will. And
Right.
They interview the caller and see and just get an assessment of if they're meeting the screening criteria, and that way we can be aware that that they would be coming at the next available external assessment testing time, and be ready. Like I say, just be ready to expect them, and so it helps us also anticipate what type of volume to expect, so we can plan for resources, etc.
Very good. And I want to ask you a bit about, as we talk about maybe trying to reopen parts of our state and parts of our economy, and it seems to me that testing is going to be a really big part of any conversations about doing that, and I think that's going to mean even more regular testing for folks, if folks need to be out and about. Do you have any thoughts about that? Does the hospital have any thoughts about that? Again, as we want to keep everybody safe, we don't want to overwhelm our healthcare facilities, but I think we all understand too that this can't go on like this for indefinitely, forever.
Yeah, you're exactly right, Scott. It will certainly increase the amount of testing that goes on, and how the hospitals will be involved in the increased testing is that there will be requirements for us that when we have a scheduled procedure that we test that patient within 48 hours of their procedure, so we can determine if they're COVID positive or not, and then likewise plan their care around that test result. So it's something we'll be doing proactively once we can open up for the services that we currently have deferred at the moment.
So there's been talk of a few types of tests, and so what San Juan Regional specifically is doing is the active virus test, not the other two tests that there's been talk about. We're not doing antibody tests over there, right? We're not doing antigen testing over there. It's just the active virus, crazy long nasal swab test.
Those are
Yes.
what you're doing, Jeff Bourgeois? Gotcha.
That's correct. Yep, that's what we're doing.
But there are other types of tests that are being developed, I know, that maybe even are faster results and things like that. Is that something you're keeping an eye on? And I know maybe even some doctors' offices that can maybe provide some faster turnaround tests as we move forward in this whole pandemic?
Well, what we've been able to do now is have our own in-house testing ability. So for patients that we test where we want a quick turnaround time, somebody who's coming through the emergency department or is being admitted or needs a test prior to a procedure, we have the ability to turn that around within a couple of hours in-house. For more routine screening, we're still working with the state scientific laboratory down in Albuquerque and sending the test down, the specimens down there on a daily basis. But increasing our in-house ability has really helped reduce our turnaround time for those patients where we need a quicker answer.
Sure, and I would think that's got to be one of the most difficult parts of some of this is just the not knowing if you have symptoms and you go in for a test and you don't get a result immediately, which we can't do at this moment, but even a couple of hours would be better than a couple of days, and so that's progress, I guess.
It really is. And we're happy to do that, and it's really that's also helped us manage the use of our personal protective equipment So if we have a patient in-house and we get a negative result back, we don't necessarily, depending on where the patient is, we don't necessarily have to use the same level of isolation precautions that we would on our fourth floor where the COVID positive patients are.
Understood. We're speaking with San Juan Regional Medical Center CEO Jeff Bourgeois. And Mr. Bourgeois, I want to ask you a bit about some of the things we hear from the state. They're looking at San Juan County and McKinley County and Cibola County, that northwest corner, and watching certain numbers and percentages and some of those targets that they're hoping to meet. Are you seeing any activity in our numbers and our new cases and the rate that we're getting new cases that's showing any progress? Are we heading in the right direction, or do we still have some work to do from the numbers that you get to see there at the hospital?
Yes and yes. So
Okay.
So bear with me. I'm going to pull up a report that we look at daily in-house, and these are for results that we do here.
Mm-hmm. I know you can't speak for other facilities, right?
Yeah. So these are tests that were drawn by our organization, either in the external assessment area or for an inpatient, emergency patient, et cetera. So to date, we have results on 2,853 tests that originated from San Juan Regional, and 335 of those have been positive. We still have another 207 that are just so recent that we don't have results back on yet. But
mm-hmm.
one thing we look at is what we call our rolling 14-day average of the percent of positive results. So it's a mathematical equation, and it kind of levels out the peaks and valleys where you have days with not a lot of tests, and other days, like on Mondays, Wednesdays, and Fridays, when we do a lot of tests because of the external assessment area. We kind of smooth that out and see what of the tests that we conducted, what percent are positive, and then do that on a 14-day average to try to smooth out the peaks and valleys from day to day. So on May 1st, so far was actually our peak, where the rolling 14-day average was 15.4%. As of May 11th, it's right at 13%.
Okay.
So it's come down, and that's the good news. The challenge is for us is that rate is still far higher than any other area in the state. In particularly McKinley and San Juan counties are experiencing a much higher percent of positives than the other counties in the state. And
can you give us an idea, Mr. Bourgeois, of what those other numbers would be like? Or is it more like a 5% or a 11% would be acceptable?
Well, I do have that, Scott. Let me flip to that slide. The statewide average right now, if I recall correctly, is 5%.
Okay, so it is that much of a difference.
Yeah, McKinley was a little higher than us at the end of last week. Sandoval down at 6.6, Bernalillo 3.7. So you can see that we are significantly higher than other counties in the state, and that's that and the growth rate that the Northwest region has seen are the two specific reasons why our counties weren't included in the relaxation of some of the public health orders that the governor announced the week before last. So we're anxious to see what announcements the governor's office has this week, as that May 15th public health order is set to expire.
Right.
And how that might be continued, modified, or whatever action she may want to take on that. But that's been our challenge. And you can go on the Department of Health's public website and see zip code by zip code within the county where those cases are. And as you might expect, the big zip code in Farmington, 87401, which is probably the most densely populated zip code in our county, has a significant number of cases.
Yes, that's one of the larger ones in the county. You're right. I think there's some others on the reservation, of course, too, and we know the difficulties out there. So you're exactly right. And of course, in the Gallup area, you can see it very clearly as well. So, well, we appreciate the numbers, Mr. Bourgeois, and I know you're keeping an eye on them. Your workers, again, are continuing to do admirable job. We appreciate their work on the front lines. We appreciate getting to talk to your doctors once in a while to see how they're doing, and so thank you very much.
Yeah, well, I would thank you, Scott and Megan. I would just encourage everybody to give a healthcare hero a virtual hug this week. It's hospital week, and I couldn't be more proud to be associated with such a great organization full of just truly outstanding caregivers.
Well, we appreciate the work that they are doing, Mr. Bourgeois. And again, I think the thing to keep in mind during all of this is to, no matter what happens with the governor's office and things in our state, we don't want to overwhelm our healthcare facilities. And I think so far we've done a fairly good job of that. Correct me if I'm wrong, but it doesn't take much to get another cluster of cases, and all of a sudden things are completely different on your fourth floor, right?
Well, you're right, Scott, and the real pressure is on ICUs statewide, and that's the real pinch point, if you will, for hospital capacity. Is in order to take care of the sickest of the COVID patients is the ICU capacity statewide, and the bigger ICUs at UNMH, Presbyterian, and Lovelace down in Albuquerque, as well as ours in Santa Fe and Las Cruces, kind of as a second tier of ICU capacity. We coordinate those transfers into those ICUs on a daily basis through a central command call center. It's very well organized, but we are watching closely the ICU capacities in the central hub, which is Albuquerque, to make sure they don't get overwhelmed. And we're watching that every day and just trying to get past really trying to understand when the peak is. We haven't hit it yet, but we hope it's just around the corner.
We certainly do. Well, Jeff Bourgeois, thank you again for your time and the information that you share with us and our viewers and listeners. We appreciate it very much.
My pleasure, Scott and Megan. Thank you all.
All right. You're welcome. Jeff Bourgeois, CEO of San Juan Regional Medical Center. Great information.
I know. What a guy.
Right?
That's it. It's
and
true.
The workers.
I know, right.
And again,
so committed.
Virtual hug to everybody at the hospital.
Mm-hmm.
So there you go. I don't know what you do. How do you do that? I don't know.
I think that's just hugging yourself. Scott.
I think it is.
You send emojis, right? Virtual
you could do that.
GIFs.
That's right.
Or GIFs or whatever.
Yeah, sure.
Yeah.
Exactly.
Cool.
Another call?
Uh-huh.
You ready?
Yeah.
Okay.
Let's do it.
Back to the phones we go. Good morning. You're on KSJE.
Good morning, Scott and Megan. This is Liesl Dees.
Liesl Dees, friend of the show.
Friend of the show.
Good to talk to you, Liesl Dees from San Juan College Community Learning Center. Thank you for calling in.
Always a pleasure to call in, and Monday seems like a good time to follow up on Jeff. He gets to give the hard-hitting good news, and then I get to give the soft, how you can help information in the county.
Well, there you go. See? It's
perfect.
A win-win.
Yeah.
We love it.
We may or may not have planned that.
Yeah. But how are things going? What's the latest, Liesl Dees?
So I'm calling on behalf of the Want to Help line, and this is a collaboration between San Juan College, the City of Farmington, San Juan County, and the San Juan United Way. And we have been maintaining a list of things that people can do within the community to help other people. And we've updated that list over the weeks, and I've got a few new things that will be going on to the list today. One you already know about, and that is the food drive that San Juan College has organized for the Navajo Nation. That was on the front page of the Daily Times today, so great job, Daily Times, in covering that. And there will be drop-offs for people to donate specific items in a trailer that will go out to the Navajo Nation in a little over a week. So I'm wanting to encourage people to pick up some extra things at the store this week. And there's a very specific list of things to bring. One is liquid hand soap. Two is paper products, paper towels, toilet paper, tissue, non-perishable food. That would be those staples, Megan and Scott, that you all have on your shelves. bottled water.
Liesl, you've met me.
Yeah.
Come on,
Yeah.
Liesl, you've
I'm
met
sorry.
both of us.
We
but-
yeah, exactly. We were just talking about cookies and cakes.
Yeah, but we appreciate you thinking that we would have those non-perishable
Yeah.
things in our cupboards. So
I have non-perishable things. They're just Pop-Tarts.
okay,
They don't perish for like 10 years.
that's true.
Yeah.
Okay,
Sneaking those in there for
Uh-huh.
you.
Gotcha.
All right, we'll work on baby carrots or whatever. Those are perishable, though. I guess they can them? Anyway, whatever.
Okay, please-
Irrelevant.
please continue.
Go on, please.
Baby necessities, and then dog and cat food would be the last item. And Scott would have that, Megan would not.
I definitely
right.
have dog and cat food.
That's right.
That I can
do not
help
have
with.
that.
So-
I can't help that.
So there you go. And I think this drive has gotten off to a great start from the reports I hear here at the college too, right? That it started, I think, on Friday. We had
That's
Danielle
exactly
Sullivan on last week talking about this, and so I think there was some good turnout over the weekend too, right?
That's exactly right. Apparently, there were people waiting for them when they started on Friday, and the pictures in the Daily Times today show, our helpers wearing masks, doing contactless drop-off, so that if you can open your trunk from the inside, you don't even need to get out of the car, making this as conscientious as possible to make sure that we are truly helping people.
Very good. Well, and it's, again, a great effort, and I know the need is great, too, because you all have been in contact with the tribal folks, Navajo Nation folks, about what they do need. That's where this list comes from, right?
That's exactly right. It comes off of the website. The items, you'll find these items on the website that the Navajo Nation is asking for generally. And that website is, let me pull it up here, NNDOH, Department of Health, nndoh.org/donate.html.
Great.
But what San Juan College did is then to try to figure out, talk to them. This is what Danielle Sullivan did, and she's an English faculty at San Juan College. She talked to the Navajo Nation and found out kind of specific things that would be helpful, and also made some decisions about what we as an institution felt that we could best do, and ask people to contribute. So there are a couple of things that are on the Navajo Nation list that we are not asking for to go in this list.
Okay.
So you can find the list for what San Juan College is asking for at our website, sanjuancollege.edu, and it's on the front page. There's a link to the story there, and it has the hours for drop-off there. It's Monday through Thursday this week, 3 to 6, Friday 1 to 4, and then Saturday 10 to 1.
Okay. And I know it's a big giant semi-truck that we're filling up with stuff, and you can see it. It's kind of off to the side of the Henderson Fine Arts Center near the Pottery area, if people are familiar with campus. But if you come in the main entrance and head towards the Henderson Fine Arts Center to the west side of campus, you will see the giant semi-truck, basically.
Sounds great.
Okay.
Excellent.
I saw it this
Good
morning when I came to campus.
Perfect.
Yes. But there you go. So wonderful.
And-
Go ahead, Liesl.
And then I have one other item that I want to let people know about. And this is a little gentler kind of, how you can brighten someone's day item. And that is a project that the New Mexico Aging and Long-Term Services Division has created called Create and Connect. And you may remember back when all of this started, people were thinking, okay, how can we be helpful to other people? And the idea of, you can send notes to nursing homes came up. And some people did should we really be sending notes to nursing homes right now? Well, the state stepped in and has created a safe way to do this. They've got rather detailed guidelines about how to go about creating a letter, and they are putting these in food packets that are being distributed to seniors across the state, and they are also sending these to nursing homes as well. And they have a campaign, too, to hashtag Create and Connect to put this out digitally as well.
Nice. And tell us the name of that website once again, please, Liesl Dees.
So for this one, you're going to go to nmaging.state.nm.us. And once
Okay.
you're there,
That's so
you'll see Create and Connect right at the top.
Okay, got it. Megan doesn't like the length of that website, but
Yeah,
other than
that's
that,
really long.
it's fine.
That's really long. All right, nmaging.state.nm.us.
There you go.
That's right.
Scott's not the one taking notes, so.
No, I just point at you and you get the pen out.
That's right.
And drop it, and then you write it down.
The junior colleague.
That's-
That's right.
I've got buttons over here
That's okay. Good point.
and keyboards
Anyway,
and
all
things.
right. We'll take this off the air.
Yeah. Anyway, thank you, Liesl. That's wonderful information as always. And the Want to Help line is really going well. And again, we encourage folks to check it out. If folks, again, want to volunteer in certain ways, you've got ways on there that they can do it and be physically distant and be safe. And then if folks need help, you've got ways on there too that folks can request assistance and things along that line. So it really does answer a lot of needs in the community during this time.
Well, we're delighted to help connect people, and we love to hear from agencies and what their needs are, if they have changed or if they have new needs in the community. Please let us know, and we're happy to get the word out about these things.
Very good. And the website, of course, for the Want to Help line that lists all those projects and things is part of the city's website, and that's fmtn.org.
That's right. And if you go to the COVID-19 section on the website, you'll find us.
Okay. Very good.
Great.
Liesl,
Excellent.
thank you so much for calling in. Always great to hear from you.
My pleasure, and look forward to seeing what you all are putting in your cabinets next week.
Okay.
Yeah, that's going to take another song.
We're on notice.
Let's barter here.
Oh, dear.
Song for cabinet photos.
Next week.
Okay.
Okay, cool.
All right. Perfect.
right.
Thank you, Liesl Dees. Thank you. Stay well.
Take care.
Liesl Dees from the San Juan College Community Learning Center. Great group of folks that we work with up here.
Right?
I have to say
Win-win.
Yeah. And again, filling this big semi-truck full of stuff for our neighbors to the west is a wonderful thing.
It is a wonderful thing.
So I'm looking
Can't
forward
beat
to
it.
I will go through the cabinets and just see
I was
what
going to say, have you filled the semi?
I need to do that. I need to
Yeah.
look for some stuff.
Yeah.
So I will definitely look at that list to see what they need and then try to be
Because Danielle and Liesl were both very specific that it needs to fit this list.
right.
Yes.
Well, that's what would help the most, and I'd rather make a big
Well,
impact
it's
than
something
send
about
something that
safety
they don't
too.
want.
Like, don't.
Yeah.
Yeah. So
So-
anyway, follow the list.
That's right. Very good. So that's true. We'll open the phones up to everybody else if they want to give a call and tell us hello this morning and give us some words of advice for the week or see how you're doing with the week. You know, if you've made a
What are you doing with
har-
your 2020 planners that you're no
harmonica
longer
out of
using?
popsicle sticks.
Or that?
Still waiting for that, you know?
Still waiting for that. And you're
Yeah.
looking at me like that's going to be this home project.
I know that.
I can bring a real harmonica and play.
I
it.
know you
Yeah.
could. That's true, and yet you haven't. So that's okay. See if that
As the
happens.
weeks go by, I was going to say, as the weeks go by, you're going to be sad that you mentioned
Probably.
that.
Oh, believe me.
Oh, believe me.
It's on the list of many things I'm sad I mentioned on this show. But yeah, to you.
to
That's
you
okay.
specifically.
Yes. But that's okay.
That's okay. So
all right.
I have a fun fact.
Okay.
Okay. So
Yeah. What is it?
Well, so we know that there's a lot of bad news out there, and that there's actually something that psychologists call a negativity bias, which is apparently related to our evolutionary heritage of just trying to survive, right? So that we were more attuned to threats, and now we've carried that over, and we're still more attuned to threats, but the world has changed. You know, I don't need to be like attuned to like saber-tooth tigers anymore, but I'm still attuned to bad news over good news, and they say it's about like a 5 to 1. So you need 5 positive things to cancel out 1 negative thing. So I was listening.
Okay.
Yeah.
All right.
So I was listening to a story about this, but at the end of this story, so I'm a big Talking Heads fan. We know that. In fact, for a time being, that was my name. Associate with KSG was Talking Heads T-shirt lady.
Oh.
Remember that?
Okay.
So, right.
Yeah.
So David Byrne of the Talking Heads, he was the front man and the songwriter for them, has started a webzine called A Reason to Be Cheerful.
Oh, nice.
Yeah, or
Okay.
reasons to be cheerful. Yeah,
Right.
And it's solutions-based journalism is what they call it.
I like it.
I know. So if you need reasons to be cheerful, check this out.
Well, and I know Dr. Mike Cadabaugh spoke with me a couple of weeks ago on our segment on Wednesdays at 8:50 a.m. talking about John Krasinski, the actor from The Office, and his little YouTube project on
Right. What does he
positive
call it?
news
Like Good in the World or Good News or something?
yeah, something.
Yeah.
But positive, like,
Right.
like what you're saying.
Right.
So,
So-
there's that.
Yeah.
So there you go. Excellent.
David Byrne.
Okay.
that guy.
John Krasinski. There you go.
That guy, too.
And I have to mention this because you brought it up the other day, I think, about the Supreme Court,
Oh, my gosh.
that they were doing
Love the, yeah.
some of the oral
Live
arguments.
oral arguments.
Right, on the I guess on
the
the
live
phone,
stream. Mhm.
and the audio was being released to the public,
Yes.
right?
Yep.
And there was apparently, this is the Supreme Court, right? The highest court in the land.
Highest
If you've
court in the land.
ever been to Washington, D.C., the marble columns.
Oh, it's cool.
It's very imposing. There's a lot of, tradition
History
and
is
decorum.
made there.
And all that stuff, right? And so apparently last week during one of these oral arguments, guess what happened?
Well, I know what happens. You go.
Somebody did not mute their microphone, and there was an audible toilet flush.
In the highest court of the land.
Yeah.
So they did not release who it was.
Nobody,
Scott said
I don't
attorney.
think-
I
don't think
say
anybody
Clarence Thomas.
has admitted who it was.
I think it's Clarence Thomas.
I don't know.
Because he never speaks from the bench. So that would be ironic. And I'm
well-
all about the irony.
Maybe. I don't know.
I'm going to go with him.
Okay. So it's a mystery.
It is a mystery.
And I don't think anyone really, paid attention, drew attention to it. I think they just tried to move on.
Yeah, exactly.
From whatever that sound was.
I hope so.
Even though we all know what it was. Let's just move on.
Well,
so
Corona Grace is what I've been calling it.
perhaps.
Yeah.
So I imagine a memo went out after that
Please
about
mute your mic.
the importance of muting. Yeah.
That's
So- Yeah.
For those of us who have to do regular things over Zoom, oh my goodness, the muting the mic thing
Right. Very
is a
important.
constant PSA.
Very important. Exactly.
In fact, we should just release new public service announcements here at KSJE.
Muting your mic.
Muting
on
your mic.
Zoom and Skype.
That's right.
Exactly. I
Your
think that's
favorite
true.
conferencing app.
Exactly. So anyway, well, thank you for joining us, everybody. Thank you for the comments on Facebook. Megan, we've got a plea for more harmonica.
Okay,
So
you asked for it.
the gauntlet has been thrown down
Yeah.
by somebody.
Okay.
And so we'll see if that was a good thing or not. But we'll see. Maybe that's something you can share later this week.
That's right.
So,
Ending with the good news.
but I have heard you play, and you're very talented. So I don't.
Thank you.
I don't think you should. Sell
Don't
yourself
hide away.
short,
Thanks.
Yeah. I think all you need is some knee cymbals because you had the guitar
Yeah.
and the harmonica, and
Yeah.
you just need maybe a
Yeah.
foot drum
Well,
and
there's
some knee
that
cymbals, and
there's
you're a
foot
one-woman
tambourine.
band.
There's
Yeah.
a foot tambourine I really want.
See?
Yeah.
There you go. Okay. Stay tuned, everybody. That's all I can say.
That's all I
There
can
you go.
say.
Let's see. Tomorrow's show, we have some guests.
Moffat.
booked. Vince Moffat, based in home health, is going to be joining us. And so we will appreciate his comments and learn how he and his staff are doing during all this. But that's something to look forward to tomorrow, everybody.
Yes.
So great.
So stay tuned.
All right, everyone. Well, until then, stay safe and stay well. And we will see you back here tomorrow morning at 9 a.m. live on Facebook and YouTube. It is KSJE's local information program about COVID-19. Have a good day.